I'm Amy Lubick, and I'm applying for the BCCDC project on extending the scope of health protection. Why, what, with whom? I believe in this time when COVID-19 has demonstrated many gaps in our system, and when climate change is exposing needs that were previously unknown or not prioritized, it's important to create a roadmap for future work. During the pandemic, health protection experienced the need to clarify roles with our interorganizational partners and propose systemic solutions to protect public and workers' health. This has given us the opportunity to explore new and expanding roles for health protection, especially those that present opportunities to increase equity in health outcomes. I have 4 years' experience in supporting the portfolios of health protection, healthy environments, and climate change at Fraser Health, and 2 years of experience as an environmental health and knowledge translation scientist at the BCCDC. Furthermore, for the past 4 years, I have been a city councilor in Port Moody. I believe my experience makes me an excellent candidate to take on this project on extending the scope of health protection in the realms identified in the project description. Should the scope allow, I'm also very interested in investigating how public health may further engage to work with local governments on the impacts of sea level rise. Additionally, COVID-19 and climate change have shown the need to build capacity and legislative ability for health protection professionals to increase worker health and safety in a changing climate. This includes food processing and production workers at risk due to extreme temperatures, as well as emerging diseases. I would also like to investigate where we can integrate policies to support population segments that are historically marginalized. In my experience, it's critical to reach out to other jurisdictions to learn from their experiences and best practices to broaden our understanding of policy and implementation complexity. For example, we reached out to Vancouver, BC, and Hamilton, Ontario, to understand the successes and challenges they have experienced with implementation of cooling tower registries to mitigate and prevent the growth of Legionella bacteria. We've used this information in conjunction with literature reviews of best practices to advocate to municipalities across Fraser Health and have had success with uptake and suggested interventions. I also have a wealth of experience advocating to senior levels of government to suggest clarification and expansion of roles for public health to mitigate gaps in perceived or legislative authority, both as a health researcher and a city councillor. I would begin this project by investigating health protection mandates across Canada, particularly looking for a broad representation of a variety of geographies. For example, urban regions may experience more sound and light pollution, while rural regions may experience more concerns with soil contamination. In more cold and isolated regions, ventilation and communicable diseases have been cited as problems. In the prairie regions, more pest control issues are typically experienced. I would also like to investigate the health protection mandates of Quebec, where climate change-related health protection policies may be more advanced. I would then coordinate my work with that at the NCCEH to develop legal questions to understand the health hazards where local public health has limited or no direct involvement, but should. This could also include new roles uncovered during the pandemic or roles that public health used to have before legislative or jurisdictional changes. This would lead to a brief review of where other ministries and agencies may have some jurisdiction, but lack policies and implementation. Where possible, I would work with the BCCDC and NCCEH staff for introductions to key health protection stakeholders across Canada in order to investigate their experiences of the current gaps, including successes and challenges and potential policy levers. I would then use my contacts to identify key environmental health practitioners, public health inspectors, and training program coordinators, in addition to those who had already been identified in previous work, to ask a standardized list of questions regarding how new environmental health mandates could be incorporated into practice. My past experience with publishing with the BCCDC and Fraser Health would be an asset in creating briefs for targeted audiences of environmental health practitioners and policymakers. Thank you for the opportunity to apply for this project.